Yeah, for 5 minutes of questions.
Thank you, Chairman Wenstrup and Dr. Ruiz, Ranking Member, for convening this important hearing, and to our witnesses for testifying. During this subcommittee's investigation of the federal response to the COVID-19 pandemic, it has become abundantly clear that throughout the pandemic, many decisions and many statements made by public health officials were not based on science. When federal officials manipulate or ignore data in order to fit a narrative, it fractures the trust between the American people and our public health leaders, and it hinders our response to developing an adequate ability to address potential future pandemics. And the trust we all recognize from this investigation, from these hearings, has been fractured. During the rollout of the COVID-19 vaccine, then CDC Director Dr. Rochelle Walensky reported that according to data, vaccinated individuals both did not carry the virus and that they did not get sick. This is not consistent with what clinical trials and real-world data showed, which is that while the vaccines can be somewhat effective, vaccinated individuals still carry the virus, and vaccinated individuals still can become sick, and vaccinated individuals can still transmit the COVID-19 virus. Dr. Marston, in order to prevent misleading statements, such as the ones that were made by Dr. Walensky, how can the FDA more effectively communicate the conclusions of clinical data used to approve new vaccines?
Well, I appreciate your question. First, I'd like to say these vaccines, no medical intervention is perfect. I think it's been said to this committee before that drinking too much water can cause water toxicity, right? And we just have to recognize that. That being said, these vaccines—
We're not talking about water and water toxicity. We're talking about misinformation.
So I think each medical intervention needs to be taken one by one, look at the benefits of those and the risks of those. So the benefits of these vaccines are very important, right? We believe that there would have been an additional 3.2 million deaths had the vaccine not been rolled out. Incredibly important. Hospitalizations on top of that. We also need to recognize and be transparent about the risks that are there. So for example, we discussed some of the work that we do trying to put out our analyses of risks that we're seeing in our various databases, putting those into the public literature, the published literature. We've done that on a series of recent cases, for example, in the New England Journal, in the CDC's MMWR. So we try to make sure that we're putting out that information and our latest thinking on a regular basis.
So you talk about that collaboration. Dr. Walk, are the CDC and the FDA regularly communicating and sharing information in order to ensure that the CDC vaccine guidance is consistent with the scientific evidence and the clinical data that the FDA is using to review and approve new vaccines?
CDC and FDA have a close working collaboration.
How often does that occur?
We're large organizations, and so we different staff.
Is it daily? Is it weekly? Is it twice a week? You talk about a close collaboration. I just need to know, as a member of Congress, how close is that collaboration?
During the COVID response.
How close is it now? We're talking about being prepared. How close is that collaboration?
It's very close, a very close.
Again, timeline. We need that
on
information.
a weekly basis.
On a weekly basis. And these are weekly meetings that are face-to-face meetings that you hold on a regular weekly basis.
At various levels of our organizations, we do meet on a regular basis.
I find regular to be really a broad-reaching term. And by failing to effectively communicate the clinical data and the results behind the COVID-19 vaccines, the CDC and the FDA have contributed to growing vaccine hesitancy among the American people, including from routine childhood vaccinations. The culpability lies within your agencies. And the responsible stewardship of federal funds is critical to the American trust in public institutions. And unfortunately, the NIH and the NIAID have completely failed to exercise effective oversight of EcoHealth Alliance when they received grant funding for research of novel coronavirus, which was conducted at the Wuhan Institute of Virology. Dr. Tabak, how is the NIH improving oversight of grant funding to ensure that failures seen, like the EcoHealth Alliance, would never happen again?
We have restated the requirement that subawardees, which is an example of Wuhan Institute of Virology, are required to provide all data in a timely manner. We have made it clear to our staff that progress reports need to be reviewed in a timely manner, and have put so-called red flags in our automated systems to ensure that a grant can't be renewed if there's an outstanding report that has not yet been reviewed or received.
Please define defining manner.
I'm sorry, say it again.
Please define what is in a timely fashion. You've said that twice to me. What is a timely fashion of response before the computer puts up a red flag?
The timing for this is when you are coming to the conclusion of a year's period of funding, you are supposed to provide a progress report, and I believe the window is 2 months. I would have to get back to you with a specific.
Please get back to us, because you're saying at the end of a year, you're given an additional 60 days to be considered providing timely information?
That's correct, because it allows you to assemble all.
What
the
happens if
data,
they don't?
And that's the point. Now,
Indeed, it is the
if
point.
they-
What happens if that is not provided?
Then they are contacted, we try and find out what is the hang-up, and if they don't provide it, then they cannot get the next amount of funding.
I think it's clear that in the aftermath of our federal COVID-19 response, you need to do a lot of work. There's significant work to be done to repair the trust between the American people and our public health infrastructure. And in order to earn that trust, public health officials must learn from these large mistakes, and it is my hope that the work of this subcommittee will help identify a path forward when responding to the next public health emergency. My time has expired, Mr. Chairman. I thank you, and I yield back.